Welcome to Medical Lab Science Quick Review. We will introduce you to the first thing we notice in urinalysis, the physical characteristics. What is the clinical significance of color in urine? We will look at relevant biochemistry, interesting pathophysiology, and a few inborn errors of metabolism. Afterwards, we'll go over questions and answers based upon our MLS ACP Board of Certification study guide. A distinct and surprisingly noticeable change in urine color and appearance will often bring a patient to seek medical attention. The color of urine varies tremendously, from almost colorless to black. We'll explore these variations due to normal and abnormal metabolic functions, physical activity, ingested food, drinks, and medications, and some pathology. Ideally, the patient delivers a midstream, clean catch urine sample collected first thing in the morning. When examining a urine sample, we need good lighting while looking directly down into the clear container with a white background. How do we get the yellow color in urine? Normally, red blood cells carry out their oxygen carrying function for about 120 days before the reticuloendothelial system takes out senescent and defective red blood cells. The answer to our question lies within hemoglobin and heme metabolism. Liver macrophages breaks apart hemoglobin. With heme oxygenase enzymes, they form biliverdin, salvaging ferric iron for later storage as hemosiderin or ferritin in tissues, and forming biliverdin and bilirubin, which is conjugated to glucuronic acid by glucuronal transferase. This bilirubin is stored in the gallbladder with bile to be used for fat digestion in the duodenum. In the intestines, gut bacteria, our normal flora, oxidizes urobilinogen to form bile pigments urobilin and stercobilin. Stercobilin gives feces a characteristic brown color. Some urobilin is filtered by our kidneys and excreted in urine as urochrome, which gives a yellow color. Variations of yellow urine color can range from pale yellow, as seen in people who drank a lot of fluids, diabetes mellitus, and diabetes insipidus, consistent with polydipsia and polyuria. Dark yellow color can arise from dehydration, burns, exercise, liver disease, B complex vitamins, and some medications. Now for some abnormal color urines. What can cause black color urine? For your information only, hemoglobin in black urine was observed and coined as black water fever by a doctor in East Africa. Certain drugs have black urine as a side effect, such as chloroquine used for treating malaria. If the urine dipstick is negative for blood, then the pigment may be melanogen caused by malignant melanoma. Another possibility is alkaptonuria, an inborn error of metabolism involving phenylalanine and tyrosine metabolism. For your information only, it is a rare genetic disease caused by an enzyme deficiency of homogentisate 1,2 deoxygenase. We see an accumulation of homogentisic acid, a toxic tyrosine byproduct. Black colored urine forms after oxidation of HGA to form alkapton. What can cause a dark burgundy red color? Some people with porphyrias have a characteristic port red wine urine color. The porphyrias are a group of inherited metabolic disorders caused by mutation of genes coding for certain enzymes involved in hemoglobin synthesis. Porphyria cutanea tarda is the most common type. Deficiency of uroporphyrinogen 3 decarboxylase enzyme leads to an accumulation of uroporphobilinogen 3 with accumulation of porphyrin rings, giving a port wine discoloration of the urine.
What genetic disease can make an amber colored urine smell like burnt sugar? Maple syrup urine disease is an inborn error of metabolism where there's an enzyme deficiency of branched chain alpha ketoacid dehydrogenase, resulting in an accumulation of branched chain amino acids, leucine, isoleucine, and valine. This amino acid urea provides an amber urine color with an aromatic burnt sugar or maple syrup aroma.
Another inborn error of metabolism is phenylketonuria, in which phenylalanine is unable to be metabolized by the liver due to enzyme deficiency of phenylalanine hydroxylase. Keto acids also accumulate in the liver. To help us remember the amino acid and enzyme, think of phenyl and add alanine. When will a urine smell like a mouse? PKU is an inborn error of metabolism in which phenylalanine is not normally converted to tyrosine, leading to the accumulation of keto amino acids like phenylpyruvic acid, which gives off the mousy, musty odor in urine. By the way, PKU screening is routinely performed with a blood test.
What can cause these urine colors?
In patients with liver disease, bilirubin accumulates, giving a dark amber urine color. When biliverdin accumulates, we might see a greenish brown urine color or a blue green color. I found this question in our ACP study guide asking about a substance that gives a blue green urine color. Other examples in our text follows. There are many conditions which can lead to a red color urine. Hematuria presents in different ways: clear, hazy, cloudy, bloody, sometimes with bloody clots. The color varies from pink, bright red, dark red, or brownish red. Myoglobinuria may arise from muscle disease or injury. Myoglobinuria and hemoglobinuria appear alike in many ways. Both appear with red urine, and urine chem strip will test positive for hemoglobin. Both may appear with clear red urine if the red cells are hemolyzed intravascularly in hematuria. To tell them apart, we can see that centrifuge blood of a patient with intravascular hemolysis will show hemolyzed blood in plasma, while myoglobin will have a clear plasma. To get a better understanding of hematuria, let's revisit how normal renal blood flow works and then some pathophysiology. Diseases affecting the glomerulus causes glomerulonephritis, with red blood cells leaking across the glomerular wall into Bowman space with ultrafiltrate to form bloody urine. In Goodpasture syndrome, an autoimmune disease affecting glomerular basement membranes of the lungs and kidneys, inflammation also causes a leaky glomerulus.
In a few hours, an interesting color change from pink and red bloody urine will oxidize the ferrous iron in hemoglobin to form ferric iron in methemoglobin, turning the color brown.
Occasionally, we see a UA sample with a bright orange color. Pyridium, an antibiotic drug for cystitis, will cause this urine color. The following questions and answers are similar to the ones in our ACP Board of Certification Study Guide. Thank you for your time, attention, and support, and we hope to see you in the next video.